Trump administration has rolled out a bold new private health data sharing system, partnering with tech and healthcare giants to create a system where they can seamlessly sync your medical records. So think Google, Amazon, Apple, United Healthcare, Cleveland Clinic. The idea here is that using medical records and being able to seamlessly connect them to fitness tracker apps, to chronic disease management programs, to all kinds of really cool stuff that could make the healthcare space a lot more efficient. But hold up, wait, there's a catch. Guess what the catch is? Privacy. Critics are saying that unless there's an ironclad prevention mechanism in place, your data could be available, maybe even for monetization. Weight loss drug Ozempic could protect the brain from stroke. So these GLP-1s must have the same PR firm that did wonders for cauliflower and for CrossFit in the years past, because I tell you what, the news keeps on being good for these guys. So here's what we're finding out. A fresh new study, three fresh new studies unveiled at a major neurosurgery conference suggest that GLP drugs like Ozempic actually dramatically slash stroke death rates, speed up recovery from brain injuries, and potentially lower the overall risk of stroke. It's kind of a digital bodyguard for your noggin, if you will. So great news on the GLPs. In other news, Republicans are in a major tug of war with themselves, really, over those crucial ACA tax credits. Some GOP lawmakers, especially those in those districts that are tight, that are fighting their butts off for re-election, they are kind of not looking forward to January 1st when these expanded ACA tax credits expire. And so they are battling internally to see if they can extend those. It might even happen at a state level. But the opening shot for the healthcare discussion around politics will happen on January 1st when these ACA credits are set to expire, increasing premiums by up to 75% for some people. Also, DACA recipients will lose their health insurance at the end of this month. Here's what you need to know. So DACA recipients are about to have their ACA coverage yanked because of the Trump era rule very recently that redefines what lawfully present means. Traditionally, dreamers, DACA recipients, dreamers have been here lawfully present and were eligible for subsidies in the marketplaces. As of August 25th, over 11,000 dreamers will lose their coverage. In California, we expect to have about 2,300 of those DACA recipients losing coverage because the definition of lawfully present will change. They still have access to Medi-Cal. They still have access to employer-sponsored coverage, individual policies, but the subsidies through the ACA exchanges will go away very soon. Doctors are being urged to run for Congress. This is a political action committee, mostly made up of Democrats, that are looking to add 100 healthcare professionals to the House and the Senate by 2030. They believe that there is a lot of healthcare policy that is being changed around this country by people that do not have experience in the healthcare system. And they feel like adding more doctors and nurses to the decision-making process would help bring more evidence-based medicine and politics and policy around that to Americans. Thanks for stopping by. We'll see you next week.